This is the Neil Prendeville Show. Tweet the show at Neil Red FM. 104 to 106 Red FM.
Michael O Doherty, good morning.
Good morning, Neil. How are you?
We've been talking over the last couple of days on the media and their importance or the responsibility of the media when it comes to the last 2 years and COVID and what we've been living with. And I was very interested to see a recent post that you put up on Instagram. And I quote you. You say, "The continuous bombardment of negativity from the media is worse than the virus." You say it's a daily ritual of psychological punishment and trauma. That's fairly heavy hitting. What do you mean?
Well, what I'm doing is I'm reflecting what I'm hearing in my clinic and from a lot of people that I meet, that nobody is denying the fact, Neil, that COVID exists and that measures need to be taken. But this hourly, not just daily, this hourly briefing and bombardment of the same language and terminology that's based on fear, insecurity and uncertainty is actually having a direct effect, not just on the psychological, but on the brains of people. And the psychological, what I'm hearing from parents and of children and need from people coming to the clinic, that they're basically saying they've had enough of it. You know, that how much more can they take? They acknowledge the responsibility of media to deliver, you know, the problems to society. But ultimately, you know, I think enough is enough. I think what a lot of people are saying out there, enough is enough, and that it is having a huge psychological effect. And we only have to look at the increase in the amount of stress and anxiety and depression that's in our society, right across the board, from children right up. Yeah.
I mean, far be it for me to defend the huge amount of COVID information that goes out on a daily basis. I'm critical of it myself, but media would say that surely people have a right to know. Surely people should have to be told all of the truths and all of the facts.
I get all that, but unfortunately, what people are being fed information today. That's one thing. A week later, it's something else, and it's that uncertainty, you know, about the whole thing. You know, so unfortunately, you know, people really need to get. What people are saying to me is they really need to get back living their lives. At the moment, the whole world and society revolves around COVID-19, you know, and it is an issue. And I get it, it's an issue, and that COVID-19 is an issue. And yes, there are responsibilities, but there's also a responsibility on governments and health leaders to look at the other problems that exist. The world just can't revolve around one condition.
But it's, and I don't think the rest of the world actually does talk as much about COVID as this country does, to be honest. That's my observation on it. But okay, so if you talk about it in that regard, you're talking about politicians, you're talking about members of NEFIT that get rolled out. Are you talking about the virologists and the epidemiologists as well that are constantly on radio, television, column pieces and newspapers?
Yes, and the rhetoric is negative. You know, it's all negative. They're not coming on with a solution. You know, we're using words like restrictions, pandemic, epidemics, you know, lockdowns. Yeah. All of this is a negative terminology. And suddenly you nearly like have a soap where everybody's coming on, and everybody in every organization, whether it's the teachers' organization, everybody seems to have an opinion, and everybody is a virologist and a biologist of some sort. Yeah. So the whole idea is, I mean, realistically, when we look at the problems in our health service and we see the huge lacking capacity to provide a proper healthcare service for our society, do the public honestly think that paying somebody $500,000, like the head of the HSE, to come on with the actual chief medical officer and others to say we have one or whatever you call it,
Omicron.
New variant, Omicron new variant. Just we have one new variant.
Yeah. What kind of fear does that put into people? And does the fear then differ depending on their maturity or their age?
It does, but what people are getting is frustrated, Neil. You know, they're actually getting frustrated because it's like I say, well, is the case now going to be that every time like a stray dog comes into your state, that everybody runs indoors and closes the doors because they're afraid of the stray dog? Yeah. So, but the point I'm making, at what point are we going to say we're going to have to live with these? And yes, you know, I fully support the measures that are taken, but the thing about it is this, that, and yes, we protect the elderly and the vulnerable and those who are immunosuppressed. And yes, I hear all that, but we have to do that with other conditions as well. And like when you see the increases like I see in children, who are suffering hugely from anxiety.
Why are you seeing more? Why are you seeing more children?
Well, first of all, since the pandemic, the lack of social connection is a huge issue for children. And when we see the studies that are done since then, and I mean, there was a study done, Neil, and I know we hear people talking about wearing face masks, and they have a positive role for sure, but we're talking about now with face masks and kids, for example. And Brown University in Rhode Island did a study, and the results showed that early learning composite mean result dropped by a whopping 23% from a high of just 119 right down to 77.21. So we're showing even the verbal development, the all of the different stages.
Yeah, I know that, and we've also dealt with the windows open and it's freezing cold, correct, and the heating is off. Yes. Are they in fear of going to school, more and more children? There is that, but then you take it on to the next level of children who are not socially interacting. So what happens then is they're opting out of society and they're engaging in a social media platform, which is where the world is going for sure. But parents and children don't seem to understand the actual consequences of that family disconnect, that we need to try and find some space and time within the home to communicate with children, because we can't suddenly just look at children's behavior right now and where they're logged onto social media and suddenly medicalize behavior and treat behavior with medication or over medicalize the whole problem. But we've got to look at the disconnect socially that's happening since COVID started, and that's why you're seeing the increase in social media, the increase in society with anxiety and depression, particularly in our young children. It's absolutely, parents are at their wits' end right now, and they're the kind of calls that I'm getting, or I might have to, in the car, a parent might ring me for some reason or other, and I have to call maybe one of their family to chat to them about a problem that they have and work in some way to try and help them to overcome their problems. Do you think that fear and that uncertainty then leads on to physical sickness?
Absolutely, because the science of this doesn't need to be understood very simply. But can I give you one simple piece of pathology in that respect? If we're stressed and anxious and full of fear, so you take maybe now today 80,000 probably children possibly haven't gone to school or refusing to go to school or not attending school for some reason or other. It is fair to accept that figure, because post COVID-19 it was 60,000+. So given, I know that when listening to what people are saying, it's more than that. But if you take a simple basic principle of it, like if we're stressed and anxious, okay, that affects our gut function. When it affects our gut function, well, what happens then is that the serotonin pathway becomes affected. So when we take in our proteins and they convert to tryptophan foods, the protein foods, they convert to tryptophan, to 5-HTP, to active serotonin, to melatonin. So if the serotonin is your good mood hormone, your melatonin is your sleep hormone. And these are the two things. People are depressed and they can't sleep. Yeah. And unfortunately, and we've chatted about this before, there is this adaptation around food, and what we're trying to do is trying to change behavior instead of looking at the nourishment that our children need, that people need, and that social connection is so important.
I know, but we are where we're at, and the whole idea is to protect the health service, to keep beds free, to keep the ICU from being overstretched or overrun. You see, that's, so what do we do?
Okay. So here's how I look at that. Right now, I honestly believe, and I probably will get ridiculed for this, but I honestly believe that COVID is being used to protect a failed healthcare service. That's a strong statement, but I think when we look at it in hard facts, if you're running a business, you have to look at where the faults and the flaws are. So we're being told that it's all about capacity. We're being told that it's all about pressure on the health service. Ever before COVID happened, the health service was under pressure. You know yourself, Neil, been involved in the media. Come November, right through to January, February, it was overcrowding in hospitals, trolleys, elderly dining trolleys. We had all this rhetoric. COVID comes along, and it now seems, and everybody seems to understand this, it now seems that what we're trying to do is punish people punish people, to actually protect a failed healthcare system.
When you say failed, you mean not enough beds, not enough ICU beds, for instance, not enough ventilation equipment, not enough staff, everything that goes with that.
Well, in 2009, the HSE said that there was a need for 517 ICU beds. Okay, now nothing about that was done. In actual fact, it's been reduced since. We know that there's a reduction in actual overall hospital beds. Now, the reason for that, I can't really.
But my understanding was that in the early, I'm quoting from the Irish Times, they said in the early days of the pandemic, the hospital system had a baseline capacity of 204 ICU beds, but it increased to just under 300. So they did add an extra 100. You're saying, I mean, do you agree with that figure, or do you think that it's not enough?
Well, like the thing in 2009, that figure was 289. So, I mean, I don't know whether it's saying the 208. So there wasn't an increase of 100. Okay. And the thing about it is our population has grown. So if our population has grown by 500,000 since 2009, we need to evolve. So the whole idea is that, if you can increase capacity. I mean, well, look at the billions that's pumped into the healthcare service. Why are we looking for beds? What happens in 4, 3, 4, 5, 10 years down the road? And I have no political affiliation to anybody. I'm just merely listening to what the HSE and the Chief Medical Officer are saying, that capacity, that the hospital service is overrun. And I get it, doctors and nurses in there are absolutely
right. But you're saying that they had the time, those in management,
correct,
to fix this before COVID came along, or any other pandemic like the likes of COVID. I would have thought that maybe COVID changed people's life for the better in some regards. I don't mean to sound naive, but didn't they take a step back, an awful lot of people, and address their work-life balance? A lot of people changed career paths. They moved to the country. They left the country. They did more positive things with their life, no?
I think initially that happened. But I think because initially there was a bit of a buzz around the place that people were working from home, they were with their family, they were out in the gardens, the weather was good, and there was the expectation that this was short term and people would go back to normal living. Yeah. Now the situation is we are seeing other types of problems, because now people are working from home, but they're working longer. They're sitting at office desks that are not office desks. They might be at a table, they might be at a chair. Yeah. I see the emergence of people coming to me now with what are called upper crust and lower crust syndrome. So the whole idea is now...
Is that spinal pain or something? Is it shoulder pain or neck pain?
So exactly. So upper crust syndrome is where you're leaning across and sitting in a wrong chair, and therefore this is affecting the upper neck, shoulders, and now we're seeing the lower back problems as well. So we're seeing people sitting on hard chairs at a computer, or maybe sitting in a bed or whatever. So the whole posture thing is causing, and I see a lot of this now. And then they're at home. And it's one thing if you're working from home or if you're working remotely. If you're working remotely and it's outside your home, that's fine. But if you're working in your home and your kids are there or you have a TV on, there's other distractions. So while some people will say it's a good thing and they can manage it, but there are other consequences associated with that. But unfortunately, Neil, or fortunately, where the world is going is onto what we now see Facebook doing. And I suppose the parents need to prepare themselves for that, and you and I need to prepare ourselves for that. We are now moving on to a whole new universe away from social media, in a sense of the internet and as we know it, and phones in 5 to 10 years time won't even exist. We'll be on this metaverse and it'll be all animation and virtual and augmented reality. And that's where the world is going. So we need to prepare our children, and we need to prepare parents to communicate with their children and to understand that. So there's, apart from COVID, I think this is one important point I want to make. Apart from the COVID virus itself happening, there's been a massive shift in how we behave, whether it's economically, going into shops, elderly people using our phones to tap, and there's a lot more buying online, and we see that COVID has shone a light on lots of domestic problems and so much. I know you've discussed all that. So I honestly think that there are a lot worse problems in this country than COVID.
Well, one of those problems, of course, is the ever-increasing waiting list for hospital appointments. And by the end of December, I was just quoting that we probably will approach 1 million people on waiting lists in this country.
Yes.
And amongst them, again, you made the point earlier on, 100,000 of them are children. They say that 9 people are being added every single hour to the hospital waiting list in the Republic of Ireland, that it'll be 1 million by the end of December. I mean, how will they ever
Never
get those numbers back?
It's never going to happen in the present model. And if you have a moment, I remember listening to a radio program, and I have a huge interest in this area. I remember listening to a radio program some years ago, and the radio program was asking one question: was the present healthcare system reformable? And there was 2 politicians, there was 2 professors of medicine, and there was 2 IT specialists. And it came to the politicians, the healthcare medics and the professors said, well, in the present state, possibly not. But when it came to the IT guys, what the IT guys said, listen, healthcare is not about science, it's about communication. The level of communication to educate the ordinary people how to look after themselves is one of the most important ways.
Keep them out of hospital, is it? Keep them out of hospital.
No, prevention.
Yeah.
We need to look at prevention. Yeah. What we're doing is it's an after effect. It's a knee-jerk reaction and trying to deal with it.
Yeah, but the problem will be... Yeah, go on.
Just one thing, Neil, just to finish that. The reason why I'm saying this, and this is the problem, we are going to see a huge increase in medication possibly on young children because of the anxiety and the depression. Now, if we are to take any, barometer from any country, we have to look at America. Between April 2019 and April 2020 and April 21, over 100,000 people died from drug overdose.
Yeah, but how does that compare? In what way does that relate to where we're living now? I mean, does that figure stack up with other years or what?
No, there's a massive increase.
Okay.
For the first time, there's a massive increase. But the point I'm making was...
Is it prescribed medication overdose death?
Some of them would be fentanyl, some of them would be narcotics, some of them, but it's from drug overdose. The point I'm trying to make here is there is some need within our society where the human being needs to be nourished. We seem to have abandoned who we are as spiritual beings. I mean, for me, in my everyday life, I honestly, genuinely believe that if I had nature, God, something to revert back to in my life, Neil, I honestly don't think I would have been able to cope with the stresses that have come off the last couple of years either. And I think that's a fundamental thing, that we can have all the technological advancements, but we need to understand the human being and the nourishment that it needs.
I was looking at an article in the Financial Times of the weekend where they were talking with different oncologists. One of them said, this has been the biggest failure in my 50 years in practice. He was talking about the cancer catastrophe that's amongst us: colon, breast, lung, brain, prostate, liver, cervix, bowel, bones, spleen. The list went on and on. He said, he made a point that with cancer, a 4-week delay in treatment means a 10% fall in survival. I thought that was a very powerful statement to make. You imagine the amount of people that are living with cancer or waiting for a cancer treatment or a diagnosis while all this is going on. Does that ever dwell in your mind?
Oh, look, I see it every day. I talk to people every day, and I'm saying to people, the ordinary people, listen, you need to look after yourself. If you want to be to come to the back of that queue, if you want to be at the back of that queue, then you have to look at your lifestyle. So we know those statistics are frightening, and it's a negative thing. But I want to say to people listening to me, 90% of modern day illnesses, cancers, cardiovascular diseases, autoimmune conditions like type 2 diabetes, rheumatology type issues, 90% of these can be prevented by our lifestyle. Yeah. But if we have people who are in a cocoon at the moment, who don't know whether they're living or dying or what's happening, who seem to see society breaking down all around them, then that's bringing huge stress. And when you're hugely stressed, that's the foundation for any illness, Neil.
Okay, but that brings me
a new language.
That brings me back to the point that we came in on. And we'll finish on the point we started on. You think there's too much messaging, there's too much bombardment in the media. What are you suggesting should happen? That there should be one person once a week, or what?
I think the first thing that people need to do is this. And Professor Fergus Shanahan wrote a very good book, and you might have often heard him in Cork. And he wrote a book, and it came out last year, and it was called, if you don't mind me saying, The Language of Illness. And in that book, he makes the point that the doctor consultant at the other side of the desk is using a language, and he needs to be aware that the person who's hearing it may not be hearing it the way he'd like it to be heard. So the point they're making to the media is absolutely, I understand your responsibility, but you need to understand the people at the other side of that screen who are watching and listening to this, that it's having an impact. They may not be as resilient. They may not be as capable. So it's not just news to them. It might be news to the people who are reading it out and so on. But to the people who are listening to it, the vocabulary is traumatic. And it's not, and in that sense, Neil, the first thing is they need to be mindful of that. And if they change the rhetoric slightly, if they at least bring some bit of good news to the TV screens and to radio programs and things like that. There's some good news. And if these guys coming on said, look, change the language. Yes, we are in a situation and this is where we're going and this is how we're going to resolve it. But nobody is saying, well, this is how we're going to resolve it. Nobody knows when we're going to get back up on that horse and ride on again. Do you get what I'm saying to you? Yeah. There is not one person who will come on TV tonight or radio and say, listen, guys, this is our situation. This is where we're being. They keep saying it's an unfolding situation, like we're almost 2 years down the road, and if we have to be running away from every variant that's coming to protect the health service, well, then I have to say we're in for a very long haul, Neil, and society is going to get sicker and sicker and sicker.
Cheers, Michael. Thanks so much for taking the call. Appreciate it as always.
Thank you very much. Thank you very much, Neil.
The Neil Prendeville Show on Cork's Red FM. Our phone lines remain open after midday.
I think what Michael Doherty is saying, in a nutshell, is that the medical and the aspects regarding sickness and diagnoses and consultancy appointments and waiting lists, the medical and the psychological effects of COVID will be far, far worse than the pandemic ever could or would be. And that's where we're at these crazy times that we live in. Bear in mind, though, that the latest update now is they're talking about the booster jab being rolled out for the 40s and upwards. They're reacting now, I think, a lot quicker now because they see what's happening in the UK, where the UK now are saying that they're going to give the booster jab to 1 million people per day, which means that in the UK they will be going hammer and tongs at it. So anyway, that's where we're at. But I thought it was interesting to get his perspective, though, because it's not necessarily COVID related. It's health and wellness in general and how people have coped over the past couple of years and how we have this train wreck coming down the track with regards to a failed health system. Anyway, that's probably with us already. The train's already been wrecked. Anyway, lines will stay open at 1850 104 106.